Hi, this is for my postpartum assessment skill. The first thing I'm gonna do is I'm gonna enter the room. I'm gonna introduce myself. Hi, my name is Gloria. I'm gonna be your nurse today. I'm gonna wash my hands, provide for privacy, check a name and a date of birth. Then I'm gonna apply my gloves and I'm gonna explain to the patient what we're gonna do today. I would ask her, when's the last time that you went to emptied your bladder? And she said she just did a few minutes ago, so that's, we want to ensure that we have an empty bladder because we're going to be assessing her abdomen area. When I'm doing a postpartum assessment, I'm going to use bubble heap. So the first thing that entails is I'm going to check her breast. I'm going to ensure she has a proper fitting bra on. Her breasts are not engorged, not cracked. There's no redness. The next thing I'm going to do is I'm going to assess her, I'm going to assess her uterus, but first I'm going to go ahead and listen because I never want to palpate before I auscultate. So I'm going to listen to all 4 quadrants of her abdomen. Bowel sounds are present and are active. I'm going to do a fundal massage here. And you always want to make sure the fundus feels like a fist. If not, you want to massage it. You never want to have a boggy uterus. The next thing that I will check is, ma'am, we're going to turn onto your side, and I'm going to be checking her hemorrhoids, if she has any, her episiotomy, if she had a vaginal birth, and I will also be checking her lochia, which I'm looking, and at this time I see a scant amount of lochia, and I'm gonna this is the time that I would do the pericare. I would remove any padding and replace it from front to back. I'm gonna turn you back onto your side. I'm gonna change my gloves, wash my hands if need to. I'm gonna apply more gloves, and I will now be looking at her face, arms, hands, and legs for any edema or any blood clots that may be forming down here. She does not look to be edematous. How are you bonding with your baby? And she says she's bonding fine there. The next thing that I will assess is her pain. Are you in any pain right now? If so, where? And she says she's not in any pain at this moment. And so I will lower her bed, raise her rail, make sure she's got her call light, tell her I'll be back to check on her in just a few moments. Ask her if she has any questions, remove my gloves, wash my hands, open the curtain, and I will go out and document.